So my patient is Stuart Little. He's a 67-year-old African American male with a history of diastolic heart failure and type 2 diabetes. He presented to the hospital with difficulty breathing with activity, as well as swelling in his lower legs. And when he came to the hospital, his O2 levels were very low. They were at 85, so they were put him on a simple mask. He reported no pain upon arrival. As of today at 2 o'clock, his heart rate was better. His heart rate was a little lower, actually, not better. It was at 88. His respirations were a little high. Blood pressure was a lot more lower, from 12. So his blood pressure at 12 was 167/85, and his blood pressure now is 142/76. There's no fever, and his O2 is a lot more better. It's at 93%, and he's on a nasal cannula. When we go to his labs, his BUN is at 944, which is super high, and it indicates heart failure. And even though he does have heart failure, it may indicate like his heart is worsening. His creatinine was a little high. It was at 2.5, so he might be having some sort of kidney issues, or he may end up going into kidney failure. So when we open up his MAR, he takes atorvastatin 40 milligrams a day, and the atorvastatin is for cholesterol, so you may be having some cholesterol issues. He is also taking heparin sodium, which is 5,000 units every 12 hours. And the heparin, I'm guessing it's for a DVT prophylaxis, just to make sure that he doesn't have any, DVTs while he's in the hospital, since his legs are swelling. Levothyroxine, 112 milligrams for hypothyroidism. It didn't say he had hypothyroidism in his past medical history. It did, but it didn't say if he had it removed or what happened. So I'm assuming that he's still having that active issue of hypothyroidism. So he is taking that medication, and he's also on metoprolol, which is a beta blocker for his heart. So it just helps with his blood pressure and his heart failure. So we are going to do our first med check, and we have atorvastatin 40 milligrams, taking one a day. His metoprolol of 50 milligrams. He takes it 2 a day, but right now he's going to take his second dose. He's going to take his first dose, actually. He also has his levothyroxine, 112 milligrams. He's going to be taking one a day. And he has his heparin, and heparin is every 12 hours. So now we're going to go and do our second med check. And now we're going to draw up his heparin. So we're going to clean it for 15 seconds to make sure it's all clean, there's no bacteria. So then we're going to take our heparin, and since it's 5,000 units, we need an ml, so we're going to get 1 ml. So we're going to draw up 1 ml, then we're going to put in the heparin, push it down, pull it back up for 1 ml, and then we're gonna do the scooping method. So we're just gonna scoop. Okay, now just add our meds. Take one of this. This one is atorvastatin. And we gave him his metoprolol and his Medicap and his levothyroxine. levothyroxine. Awesome. Now we're gonna do our third med check. So before I go into my patient's room and do the third med check by the bedside, I would have had a nurse double check and see how much heparin I had in here, since it's a high alert medication, and I also have my label. And now I'm gonna go into the patient's room and I'm gonna pump in. Be like, hi, Mr. Little, how are you today?
I'm doing good. How about you?
I'm pretty well. My name is Coffee. I'm a nursing student. I'm gonna be giving your medications today.
Okay.
Awesome. Can I get your name and date of birth?
Stuart Little, April 2nd, 1953.
Wonderful. And now I'm gonna scan the patient's wristband. And I'm gonna scan the meds to go into the MAR. And where was your last injection site for your heparin?
My left abdomen.
Okay, now I'm gonna give it to you on your right abdomen, and I'm gonna swab the injection site for 15 seconds. And I'm going to take my heparin and cap it and squeeze on some fat so we can get some subcutaneous tissue. Push in, pull out, pull off my safety. And so do you know what kind of meds you're having today?
Yeah.
Okay, awesome. So I have my levothyroxine, my atorvastatin, and my metoprolol, and I'm gonna give the patient a cup of water. And here you go. Awesome. And now I'm gonna lower the head of the bed, pull up 2 side rails, give them, here's your call bell.
Thank you.
And is there anything else I can do for you?
No, thank you.
Awesome. And I'm gonna pump out, and that's the end of the scenario.